Every week I come on and I answer questions that I get asked to me during the week. And this week I'm very excited because I get to have Dr. Jimenez come on board. And today's, questions we're going to answer together are all about psychoeducational testing. So for those of you that don't know me, I'm Nicole Santamaria. I'm an occupational therapist, the founder of Miami Handwriting, also occupational therapy for real life. And I get tons of questions for my whole career all about testing from teachers, administrators, parents. So Dr. Jimenez, if you want to introduce yourself really quick, and then we can get to it.
Sure. Thank you for having me, first of all, Nicole. It's a pleasure to be here.
I'm excited we're doing this.
I'm so happy to be with the community out there. So welcome, moms and dads, and hopefully we could clarify and raise the awareness in regards to psychoeducation. So as Nicole said, my name is Jimenez. I've been in practice for about 15 years as a school psychologist. I'm a licensed school psychologist. So I basically help families, teachers, children learn more about the way the mind works. So I kind of consider myself somewhat of a brain detective, investigating, conducting what I call activities. So I don't really like to call them even tests, to understand how children's brains like to work and how we like to learn best. So I'm very happy. I love what I do. It really fuels my soul to work with such amazing families in the community. I worked for the public school system for several years, for about 11 years, and I've been working in private practice probably for the past 5 to 6 years here in South Miami.
Let us know, what is psychoeducational testing?
Okay, so basically in a private setting, the psychoeducational process. So I like to refer to it as a process.
Beautiful. Let's do that. The process. I love it.
A process. It's an investigative process, because I do often get calls, and when I have a parent, they're like, they want me to do a psychoedu, something like that. I'm like, okay, it's a process. You're at the right place. So basically what it involves is, my analogy is it's similar to a roadmap. Okay, so we want to further understand your child's capacity. How does your child like to learn? Are they more visual? Are they more auditory? So the first component usually is an IQ assessment. So it evaluates the child's cognitive ability. So parents are like, okay, so what is that? So we want to know a little bit more about your child's verbal reasoning. How do they reason with words, with language, with their vocabulary? How do they visually problem solve? Okay, because when we remove the verbal component, we have visual problem solving, attention to detail, abstract reasoning, your child's memory. How do they retain information auditorily, visually, and how do they work quickly? So that's the basic IQ component. So the IQ assessment is part of the psychoeducational evaluation, and the IQ assessment is what's used in a gifted evaluation. Okay, right. So that's one question I often get. So wait, is the IQ part of it? Is it a gifted test? No, the gifted test is an IQ assessment, which is part of the psychoeducational evaluation. So that's basically the first component. So we want to know, is a child of high cognitive ability, low? Are they a slower learner? Are they intellectually disabled? So it does give us some guidance in regards to the child's ability to learn at the same pace of their peers. Okay, so that's the cognitive ability component. Then we have the academics. So academics is basically what they learn in school: reading, writing, math, fluency skills, across various subtests typically. And then we have cognitive ability. So the cognitive ability area looks a little bit further into any weaknesses perhaps that we may want to investigate. So this may be fine motor.
I'm guessing you take the information from the first two parts, your IQ, your academic, and then detective hat back on to see where do I need more information.
Exactly.
It works.
Exactly.
Right.
Exactly. So
the IQ is basic, but it gives you so much information if you know what you're looking for, and if you know what that looks like in the classroom, what it looks like at the dining room table. What does when your working memory look like when it's not working? Once you know, then you match it to the academics, and then you can continue.
Exactly. So this process is definitely step one, and step two will give us some guidance as to step three, which is the processing. In addition to like the behavior, like any developmental history provided to me by the parent, any observations, like the teacher says she has to repeat directions numerous times. The teacher says that, John has to be prompted numerous times, and that'll give me some guidance as to where do I want to look a little bit further. Sometimes, it's very comprehensive, and we look across a variety of different processing areas, which may involve the visual processing, executive functioning, memory, auditory processing. So there are a lot of different processing areas. Okay, so usually if I hear the teacher says he has a processing issue, I always need to probe further, because processing is very broad.
Sure.
Right? I always hear that the key terms are processing or there's a gap. Okay, we need to be more specific. So, but that's my job. So that's part of my detective abilities. So we go into the processing. That gives us a better inclination as to if there really is a deficit. So that being said, Nicole, and I'm sure you could relate, because the OT evaluations also are they're based on chronological age. So they're normed according to the child's chronological age. So it's not according to the grade expectations. It's the child's exact age, which I think is so important to add clarity, where sometimes we have children that are on the younger side of the grade, and they may appear like they're really struggling significantly, but really just developmentally, sometimes children are appropriate, but given their peer group, they seem to be way behind.
And that's when it gets tricky, because developmentally they're, within the standards, but then when they're functioning and they're not able to keep up. And then as a professional, you're kind of like, okay, real life versus the other real, so it's really hard for the parents to navigate it, because developmentally they're okay, but they're in an environment, especially I see it a lot more when they're really young. Like,
yes.
If they happen to be in a, preschool class where they're really like doing writing and words, and I see that big gap a lot. First grade, second grade, the reading, 6 months can make a huge difference in a reader.
Completely. Yes, I couldn't agree with you more. So sometimes, perhaps the school's curriculum is working on fluency, yet the child still hasn't mastered decoding. So there we come across, a little bit of struggle, and then that may reflect differently or be perceived differently by the teacher. So I find that this process, especially like the academic and the processing components, do provide a lot of these answers that, the professionals and the families are seeking. So, that is, in terms of the processing component, that's the third piece. And then the last piece would be the social and emotional. So obviously we go into different observations. So I collect data from the teachers, from the parents, based on, in order to observe the child across different settings, which is very important.
Definitely.
And that may also involve some clinical questionnaires that the child completes as well, as long as it's developmentally appropriate. So that is, I'm a strong believer in a comprehensive evaluation. You can never exclude social and emotional. That's so important.
It's great when you get the child that's old enough to give you feedback on it, because that's so telling when they're like, oh yeah, it actually does take me like a really long time. Like I hear the question and then everybody else answers it and I'm still thinking of the answer. It's like, I get the answer, but I get it after everybody else gets it.
Yes. And obviously it varies. There's some children that have incredible self-awareness at the age of 6, and they're able to have a conversation. They have great social awareness, able to tell me what's going on with their peers in comparison. And, so it all depends on the child, but it's definitely a component that I never exclude from an evaluation. And then obviously the most important piece, in my opinion, is the recommendations, right? So then that's where you have we have like the outline, which we need to be very cautious. So what I do is I have a conversation and I have a feedback session with the families where we go through the recommendations and really explain them in layman's terms, because it could be very overwhelming. We do provide various accommodations for the schools, tips, strategies that are all personalized for the child. Okay. So given John's limited working memory skills, these are the recommendations. Given Michelle's auditory processing weaknesses, these are the recommendations. And then it obviously may involve referrals to other professionals in the community. So I'm a strong believer in specialists, and I am not an occupational therapist. So, I will recommend to occupational therapists, to speech and language pathologists if need be, to neurologists if there's a presence of ADHD. So that's a very, important piece, and I have that communication that in that feedback session with the parents. So that's basically the process, okay? So how does it manifest, right? So what I do is I separate the sessions, usually across 3 to 4 days, and it's usually about it could be anywhere between 5 to 7 hour process, depending on the child, the age, the behaviors that the child is presenting. A variety of factors can impact that.
Let me ask you this question. Even if you had a kiddo that came and was like ready to go and was like the best taker and wanted to just like plow through all your tests, would you still want to see them on separate days?
Yes. That's my non-negotiable.
Yeah, because
yes.
Yeah.
Yes. And I do another non-negotiable is the time of day. So I typically discourage afternoon testing. It doesn't, work quite as well. There's fatigue, and honestly, it diminishes the fidelity, I feel like, and the optimal results. And it's all about, validity. Are my tests really assessing what they need to assess? And the last thing I want is a tired child coming in, even if it's 3 hours of virtual school in the morning. Zoom fatigue. So, and that could impact like the visual processing. That could impact their motivation to work with me. So
everything, all of it.
Mm-hmm.